Panic attacks can make you feel like you're having a heart attack, like you're dying, heart slamming in your chest, can't get a full breath, hands going numb, vision tunneling, and that voice in your head saying, "This is it. Something is seriously wrong." Maybe you called 911, maybe you drove yourself to the ER at midnight, but your chest exam, EKG, and blood test all came back normal. You were told your heart is fine. You had a panic attack. In this video, I'm going to show you exactly what happened inside your brain and body during that attack and the real biology behind every terrifying symptom. I'll explain why some people are wired to experience this more intensely, and I'll show you what actually interrupts the cycle. I'm Dr. Air, quadruple board certified psychiatrist. I've worked with thousands of people struggling with anxiety, and panic attacks are among the most frightening and misunderstood experiences I encounter. When it happens, people are convinced they're having a heart attack or a stroke. Some are sure they're going insane. They're not, but the fear is very real, as are all the physical symptoms. So let's talk about what's actually happening. Deep inside your brain sits a small almond-shaped structure called the amygdala. Think of it as your brain's smoke detector. Its only job, all day, every second, is to scan for danger. When it detects a threat signal, it triggers the alarm instantly. That alarm triggers a massive release of adrenaline and cortisol, and within a few seconds, your entire body shifts into survival mode. Heart rate surges, breathing speeds up, blood pulls away from your gut and floods your arms and legs, muscles tighten, pupils widen. Your whole system is now optimized for one thing: fight or run. This is the fight or flight response, and it is genuinely brilliant. If a car runs a red light and you need to jump out of the way, that system fires and it saves you. No thinking required. The problem is this: your amygdala cannot reliably tell the difference between a real physical threat and a perceived one. A lion jumping out of the bushes, a terrifying thought at 2 a.m., a strange body sensation. To the amygdala, same thing, same alarm, same full body emergency response. That's a panic attack, a smoke detector going off when there's no fire. But here's what I want you to understand, and this really matters. The symptoms you felt, every single one had a biological cause. Nothing was made up. And in a moment, I'll explain exactly why you felt what you felt, symptom by symptom. The scariest thing about panic attacks is how physical they are. Tingling hands and face happen because during a panic attack, your breathing becomes fast and shallow without your control. This rapid breathing causes your body to lose carbon dioxide too quickly. When carbon dioxide levels drop, blood vessels in your hands and face narrow. This narrowing leads to tingling, numbness, or a crawling feeling in your fingers. Chest tightness occurs when the intercostal muscles between your ribs contract strongly as part of the stress response. This tightening, combined with rapid breathing, produces a squeezing pressure in the chest that closely resembles the pain of a heart attack. Dizziness and the unreal feeling occur because rapid breathing lowers carbon dioxide in your blood, which makes blood vessels in your brain narrower. With less blood flow, you feel dizzy. The stress response can confuse your inner ear, which helps with balance. This confusion makes you feel off balance or unsteady. Your brain's alarm center then partially detaches you from your environment to protect itself. That's derealization. There's also a disconnection from yourself called depersonalization. The dangerous part is the cycle. The dizziness causes more fear. More fear worsens derealization and depersonalization, which triggers more panic. These reactions reinforce each other, escalating panic. But here's what matters. This is biology, not breakdown. Understanding what's happening is the first step to stopping the cycle. But here's the thing, not everyone who gets stressed has panic attacks. So why you? And if they started recently, why now? The first factor is nervous system sensitivity. Some people have an amygdala that fires more quickly and forcefully in response to perceived threats. This can be genetic, but can also be trained by early trauma, chronic stress over the years, or a nervous system that has simply never been given the tools to properly reset. The second factor is your baseline. Think of your nervous system like a stress thermostat. When you're chronically sleep-deprived, overworked, inflamed, or running on caffeine and skipped meals, that thermostat is already set dangerously high. You don't need much to tip over into panic. You're one stressor away at all times. This is common as we age. I see adults in their 40s and 50s who never had panic attacks before, now having them often. What's changed? Cumulative stress, hormonal and sleep shifts, metabolic changes, nervous system reserves deplete, and the panic threshold drops. The third factor, and this one surprises people, is blood sugar. When blood sugar drops rapidly, your brain reads that as a biological threat and releases adrenaline to correct it. That adrenaline surge feels identical to the beginning of a panic attack. If you're skipping meals, eating high sugar foods, or dealing with insulin resistance, this could be contributing to your panic attacks. I'll be making a full video on the connection between panic attacks, blood sugar, and insulin resistance. This is one of the most overlooked aspects of this conversation. Now, here's where panic becomes its own prison. It's like the trap inside the trap. After your first panic attack, your amygdala files it. It catalogs that experience as one of the most dangerous things that has ever happened to you. And from that point on, it starts watching for any sign that it might happen again. So now, when you do things that increase your heart rate slightly, like climbing the stairs, your amygdala notices. It whispers, "Is this the beginning?" That whisper causes a small spike in anxiety, which raises your heart rate slightly, which the amygdala notices again, which raises the anxiety more. You're in a loop where the fear of panic brings on those very symptoms. One of my patients described this exactly. She was a high-performing attorney in her early 50s. She told me, "I'm still afraid of the panic attacks, but I'm also afraid of being afraid. I'm afraid of what it does to me, waiting for the next one." That's what the cycle does. It doesn't just attack you in the moment. It quietly rewires how you move through your day, what you avoid, where you won't go alone, what you won't do anymore. But here's what I need you to hear. That cycle can be interrupted. The same brain that learned to panic can learn something different. So what actually works for panic attacks? The first intervention starts right here in this video. Understanding. When your brain knows, not just believes, but actually knows that panic is a misfired survival alarm and not a medical emergency, it changes how the prefrontal cortex responds to the symptoms. Knowledge creates distance. Distance breaks the catastrophic interpretation. And breaking that interpretation slows the spiral before it accelerates. The second tool, your exhale. When you extend your exhale longer than your inhale, breathe in for 4 counts, out for 6 or 8, you directly activate the parasympathetic nervous system. That's your body's built-in brake pedal. It signals the brainstem that the threat has passed. Adrenaline drops, heart rate slows, the smoke detector gets the all clear signal. The third tool is uncomfortable but essential. Stop running. Every time you avoid a situation, a sensation, a place because it might trigger panic, you're teaching your amygdala that the fear was justified. Avoidance makes the alarm more sensitive, not less. Gradually, carefully, with the right support, learning to move toward the discomfort is how the nervous system relearns safety. The fourth tool is medications and therapy. Medications like SSRIs can take the edge off panic, and sometimes that's exactly what someone needs to get stable. But the research is clear. CBT is equally effective, often longer lasting, and teaches your nervous system something medication alone never can: how to stop being afraid of fear itself. Lastly, there's the fifth tool, the foundation. This includes blood sugar stability, reducing caffeine, managing inflammation, gut-brain connection, mitochondrial health, hormones, and sleep. Poor sleep raises cortisol, sensitizes the amygdala, and affects how your brain responds to serotonin and GABA, the very neurotransmitters that keep anxiety in check. I've put together a free sleep guide in the description below. Download it, use it, share it.